Okay, so my name's Jason Lowe. I'm an orthopedic trauma surgeon, which is a fancy way of saying I fix broken bones for a living. I came to the Arizona, Tucson area about 5 years ago. Here, I function as a fracture specialist or orthopedic trauma surgeon. I'm also the medical director for the Department of Orthopedics at Banner University Medical Center, Tucson. My philosophy on care as an orthopedic trauma surgeon is restore function as quickly and as completely as we possibly can, taking into account all the parameters that each individual patient is.
Awesome.
And we're seeing traumas every single day, multiple times a day. And we use blood products almost every single day. In trauma, sometimes it's just a little bit or a single unit of blood product that an elder adult needs to help them out and really help their heart out during a hip fracture surgery. But more often than not, it's much more significant than that. It's a real bad car accident, motorcycle accident, or God forbid, a shooting. And then we're talking about multiple units of red blood cells, of platelets, of cryo, of FFP, everything that we have in our armamentarium, all the good stuff that we get every time somebody donates blood, we use, and it's literally to save lives. To the question about blood shortages, over the course of my training and my career, we've come across some rough patches, but the last year and a half and really the last 6 months have been almost dire. The blood bank is reducing the number of allocated units that they give to all hospitals, and not just in Tucson and not in Arizona, but across the country. And that has ramifications. Fortunately for us here in Tucson, specifically at Banner, we have not had to ration elective surgical care. Our own blood bank liaisons and leaders have really done a really remarkable job. And I think it's because we're so thoughtful and mindful about when we give blood products that we've been able to do that. I can't say that across the board. There are hospitals in the Tucson area that have had to limit the number of elective surgeries because they just don't have enough product to go around, because patients like that I take care of, the trauma patients, really need those now, and there's no elective to their urgency. So the shortage now is real. It has not directly impacted our operational tempo here at Banner, but it is affecting other Tucson hospitals, and that means it's affecting other patient care. So we really need more people who can to donate blood. Coming into the trauma bay here at Banner University Medical Center in Tucson, our team sees you. There's a rapid assessment both by EMT in the field and our team here. And we're able to start to give you blood so that you can stay alive. And there's no hyperbole or exaggeration there. Those blood products in that first hour, that golden hour, is what keeps you alive, so that we can get you back to the operating room. We can get your pelvis fixed. The general surgeons can get your abdomen packed or get the organs taken care of. And then to watch that person walk back into clinic in 2 to 4 weeks with a smile on their face, they're still talking. They may not be super excited because they're still healing from their wounds, but they're alive and they're recovering. And they're doing that because somebody took time to donate a unit of blood. And you said, the message to our donors. I'm actually hoping that this message reaches people who haven't yet donated blood ever in their life. And I'm going to ask you in this moment, take time, reach out to the blood bank, and come in and donate blood so that you can literally save someone else's life. What I would share with the public is that an hour of your time saves many, many lives. And we are at a point, not just in Tucson or Arizona, but in the entire United States. We need blood to save lives. So please take time, donate. It costs you nothing to save a life.